Job sites can be isolating. They may be out in the middle of nowhere putting up a data center, or any other construction site. So there tends to also, along with those things, be a culture of substance use or misuse. There is a large veteran population in construction. There's multiple factors that go into the risk of why construction has a higher rate of suicide than most other industries.
Welcome to Spill the Ink, a podcast by Reputation Inc., where we feature experts in growth and brand visibility for law firms and architecture, engineering, and construction firms. Now, let's get started with the show.
Hi, everyone. I'm Stephen Gallo, your host and the Vice President of Client Services at Reputation Inc. We're a public relations and thought leadership marketing agency for B2B professional services firms, including architecture, engineering, and construction firms. You can learn more at rep-inc, that's inc with a K.com. Okay, before we start today, a quick note. Today's episode is going to be discussing topics of suicide. If you or someone you know is struggling, help is available. You can call or text 988 anytime in the US and Canada to reach the Suicide and Crisis Lifeline. So let's jump in today. Construction has a well-known safety culture. Hard hats, OSHA training, fall protection. But the industry has a mental health safety crisis that is hiding in plain sight, really. Suicide claims 5 times as many construction workers' lives each year as on-the-job injuries do, which is staggering, really. And today we're talking about what AEC firms can actually do about it and why communications and culture are at the heart of that solution. Our guest is Sonya Bohmann, Executive Director of the Construction Industry Alliance for Suicide Prevention, which is a nonprofit dedicated to making construction a zero suicide industry. Welcome to the show, Sonya. Thank you so much for coming on.
Thanks for having me. I'll make it easy for you. We can just call it CIASP from here.
CIASP. That works for me on second reference. Yes. So tell us a little bit about CIASP and sort of what drew you to this work in the first place.
Absolutely. So I come from construction, like construction, remodels, refreshes, facilities maintenance. And I did that for over a decade and really loved it. I mean, the people of construction are dedicated and strong and gritty and all of the things that we think about when we think about construction workers. Um, but I'm also a loss survivor. And so having an opportunity to merge two things that I'm passionate about was really my dream job. And that's how I ended up at CIASP. There's lots of sort of winding roads in between there, but that's the short end of the story. And so I get to work with an incredible board of 15 volunteers that sit on our board of directors that truly want to move this mission forward and work tirelessly every day to do that. We are a small nonprofit. We focus really on construction, suicide prevention, and mental health only. And I am their only paid employee.
Wow. And it's such important work, and so grateful to have you on to talk about it because, as we mentioned off the top, the suicide rate in construction is striking, right? I mean, more than 5,000 workers a year die by suicide compared to a fewer than 1,000, as we mentioned, from on-the-site job injuries. What have you discovered in your work? Can you give us some insight into what is driving that at its core?
So there are some very specific risk factors to construction. The things that we can easily think about, the fact that it is really hard on our bodies. So there's chronic pain involved in construction and the work that we do. The fact that there's a lot of isolation where either you are isolated because of the position that you hold. So sometimes it's from a leadership standpoint that there's that isolation and you don't feel like you have someone else that's either at the same level if you're a very small construction company, or that you can even share. You certainly can't share down when you are an independent company because you scare all of your employees then. So it's really hard to have that peer group, but also we ask our employees to travel a lot. And so they're not with the communities that they're used to. And job sites can be isolating. They may be out in the middle of nowhere putting up a data center, or any other construction site. So there tends to also, along with those things, be a culture of substance use or misuse. There is a large veteran population in construction. There's multiple factors that go into the risk of why construction has a higher rate of suicide than most other industries.
It makes sense. Yeah, a lot of factors sort of swirling together there at once. And of course, as employers who employ construction workers, laborers, they want to take action. They obviously recognize this is a current and present issue, but they may not necessarily be sure how. And so where do you advise they sort of begin in terms of a place to start to tackling this problem?
Well, this is my favorite conversation. Kind of giving people that first place to start. I would say, obviously, take our pledge to stand up to suicide prevention. It's 100% free. You can do that right on our website. It's preventconstructionsuicide.com. And what's really great about it is that you can kind of make it a splash if you want to. You can do it very casually if you want to. But then from there, it means that you've entered the conversation. And obviously, all of the resources on our website are 100% free, and you can figure out which ones work best for you. And we'll have some time to share some of my favorites as we go along. But then just start entering the chat, as they say.
Hmm.
And so you have two opportunities really that are sort of national. You have Mental Health Month, which is a really great way to start entering the conversation, and that's in May. And then you also have September, which is Suicide Prevention Month. But really, there's a calendar of events. If you look at national dates that affect mental health, there's a calendar of events where you could almost every single month tie something back around to the mental health conversation. And it doesn't always have to be we go from not talking about this at all directly to talking about suicide prevention, because there's a big spectrum in between those two things. And so just doing really small, simple things to start slightly changing the culture then starts to have a snowball effect.
Yeah, I mean, I imagine that's the hardest part, right? Is starting that conversation because you don't know
Right.
necessarily how what's the entryway into that conversation. So, like you mentioned, there's opportunities to kind of have an outside external date or an excuse, if you will, for lack of a better word,
Right.
to
Yep.
bring that up, right?
Absolutely.
Yeah. What then would you say is the most common mistake, I guess, you see when firms first try to address communicating around mental health and engage in these kinds of conversations?
When it becomes a priority or a flash in the pan, it needs to
Mm.
really be a consistent conversation. So it can't just appear that we're checking a box. And so if it is just for this moment, the priority, because we want everybody to see that we're doing this, but it's really about making that cultural shift. When you make the cultural shift and it goes from a priority to a core value, that's when you have real change.
So important. Yeah, it's not a one-off sort of a thing. And so, to make this a year-round conversation, what are some ways that firms can do that? Because, like you mentioned, there's some observances throughout the year on the calendar that lend themselves to this. What does that look like? I guess on the ground.
So the one thing that I think is the easiest, the least expensive, and the way that starts to signal to your company that you are going to make a culture shift is change your email signature. It's so
Mm.
simple, but simply have it say, if you or someone you care about is in crisis, contact 988. And then people see it every single time you send an email. I know I personally send hundreds of emails a day, and so do most of us. So when they start to see just that small change, it's a really good way to start dipping your toe into the conversation. And then start observing things like Mental Health Month at a safety stand down or at your company all hands or town hall, whatever you call it, that or in your newsletter even. Just start mentioning that May is Mental Health Month, and then that starts sort of the conversation to get us towards September. And then in September, start talking about that it's Suicide Prevention Month. Put some of the resources up. Start using 988 stickers or put 988 stickers around your office or your job site. Introduce warning signs. They're just really
Mhm.
simple ways to start messaging that don't feel so kind of a change in the shift of what you've been doing, or don't feel so maybe aggressive in the conversation.
Yeah, no, that's a great point. I mean, and the consistency piece of it, right? Because I mean, when it's something that's never talked about,
Correct.
but once or twice a year, that's when it
Okay.
becomes like this big deal, right? So that's huge, and a great point. some of the largest clients in the industry too, right? I mean, you see some of these big firms, or may have big parent companies. They require some sort of mental health component as
Mhm.
just even part of the proposal process that we've seen. I'm curious, sort of what you've sort of seen in your work, and how significant is that shift? Do you see that as something that perhaps will continue?
It's gigantic, and in such a great way, because it's starting again that conversation that we're just not having enough of. And so requiring it in the proposal process. New York has just passed a law in New York City where it's required in the permitting process, even that you have to have a mental health component to the training, just like you have your OSHA training.
Yeah.
And so it really allows us to start having conversations in places and spaces that we wouldn't be having it. And it that starts to shift the culture of the entire industry then.
Yeah. Yeah. It's a long-term play for sure.
It is, absolutely.
So tell me a bit about CIASP's free needs analysis tool.
Mhm.
Love to learn more about this, and how it works, how firms can access it. Tell
Yeah,
us more.
absolutely. So that is kind of step 2. You take
Okay.
the pledge to stand up to suicide prevention, and then you have
Yep.
this needs analysis. And what it really does is, I liken it a little bit to a choose your own adventure, if you remember those.
Of
But you
course.
really have an opportunity to start with laying out what you have in place from a mental health and suicide prevention or wellness program, and then where your gaps are. Really, it digs as deep as finding out not only what you have in place, but who's responsible for it. Because if there's no one responsible for it, isn't really in place. So,
Right.
so then
Yes.
it gives you, and then from there, it allows you to say, well, where do I need to go next? Because people enter this conversation in lots of different ways. So you either enter with awareness, like the conversation we're having now, like how do I start having this conversation? Or you enter in, and we call that sort of prevention, or you enter in the intervention where you've maybe done a little bit of prevention, you've seen the 988 posters, you know it's mental health month, or you know it's suicide prevention month, and you want an actual training. So that's intervention. Or you have had a crisis and now you didn't know what to do at that time, and so you need sort of a plan. So that's another place that people can enter the conversation. And then the needs analysis will tell you what you're missing there as well. And then, unfortunately, some people enter the conversation at postvention after a
Mm,
suicide loss. And whether it happened on a job site, it happened that the job site was used as someone's lethal means, or it happened to an employee that works for the company, but maybe didn't happen during working hours.
mm.
That's another way we have to start the conversation as well. And so people come to it from different places. And from there, then you can kind of choose what resources you want to put in place first. And the needs analysis directs you through that process.
Oh, well, that's excellent, though. I mean, it sounds like, it's a tool that, right, kind of is meeting you where you are, but then also helping sort of establish, all right, what's the baseline of what we are doing, what we could be doing more. That's incredible. And I imagine too, you're having conversations with folks across the spectrum in the industry on the operation side, your HSE folks.
Yes.
But for our show, a lot of folks who are listening and our audience are these communications professionals, marketing directors, and obviously, communicating is a huge, if not central, part of this.
Mhm.
So, for that marketing director internally who wants to really be a champion for this, but they may be getting some pushback from leadership for one reason or another, or it's just not, like you mentioned, it just hasn't been the cultural priority maybe up to this
Right.
point. What's your advice to someone in that scenario of how to sort of shift that conversation?
So it goes back to what I mentioned before is that there's that national calendar that has a day
Mhm.
in every month. So if you think about there is May is mental health month, June is men's health month, July is minority mental health month, August is safe and sound week. And so there's all these little places where you can bring the conversation in. And that's exactly what I would suggest a communications director or marketing director does is start messaging based on that. Start messaging for recovery month, start messaging for alcohol awareness month. And it can be something as simple as if you are talking about recovery month or alcohol awareness month, instead of making it a big mental health conversation, post a mocktail recipe in your in your newsletter, or give people for dry January, do that same thing, and then a little stat about why it's important, how it affects your mental health. And that, it doesn't have to go to, you don't have to necessarily post about bipolar month, because that's taking that leap that's really large when we're talking
Yeah.
about this. But there's small little things that we can sort of weave through that. There's World Music Day, post about the effects of music on mental health. We do that often, and it's just ways to message, and give yourself an opportunity to message that are a little bit more subtle sometimes, because we need that initially. And then once you've sort of made this part of the everyday conversation, then you can really start training on it.
Yeah, I imagine that's an intimidation factor for some, or feeling like they need to go 0 to 100,
Exactly.
immediately. I'm curious, yeah, can you share, I mean, any examples that you've seen of sort of that easing into it, or just other maybe, I don't know, strategies or channels where you've just see this work well and successfully for construction firms?
Yeah, I mean, so we see it in all different places. Obviously, there's large construction companies that have gotten on board with national initiatives, and that's worked really well for them because they can sort of move. It's like turning a limousine, right? You got to move it
Hmm.
all at once, and so that works for them. They will take Mental Health Month or Suicide Prevention Month and go all in, and that's when they'll introduce things like their EAPs, or a new training program that they're going to do. And so that works really well on a larger scale. Medium companies maybe don't always have those same resources. And so it's really for them about communicating in smaller pieces. We've got a really great toolkit for Mental Health Month. So it allows a company to take the 5 weeks that are typically in May and use one of our toolbox talks that go with that. So you introduce the conversation in a toolbox talk that week. You have some things you can hand out that we all have available, like stickers or hard hat stickers, or wallet cards or coins. And so there's a plan that's already laid out for you. And that's a great way to do that without, again, it being hard or expensive. And then smaller companies can do those things that we chatted about, like add it into your newsletter, or do it at a safety stand down that you have before your job opens, and just again introducing that conversation. So it's about meeting you where you are and being able to have a resource that works for where you are too.
Yeah, absolutely. Because again, big or small, there's a place to
Right.
start, and
Mhm.
so important though to start that conversation if it's not being had already. Um, Sonia, what I guess would be the most important lesson you would hope listeners take away from our conversation today? I mean, like we've said, there's opportunities throughout the year. There's places big and small to start. But I guess if there's one thing to walk away with for communicators in the AEC and construction space, what would that be?
This isn't going away. And
Mm,
so making it a conversation that's starting now before you have to enter the conversation at a postvention piece is important. So figure out what works best for you, what feels most comfortable for you, but start the conversation.
start somewhere. Yeah,
Start
that's the
somewhere.
hardest part.
Yeah.
But once you get that momentum rolling, it just, yeah, I imagine it becomes so much easier from there, and that much more important. So,
Absolutely.
anything we haven't touched on yet today that would be helpful to share, or that I should have asked about that we haven't had a chance to connect, or perhaps again, I know you mentioned some of the resources you guys have available. Any place else to point folks to be able to learn more after this?
Absolutely. I would suggest, if you're not already following us on socials, so it is at the CIASP or Construction Industry Alliance for Suicide Prevention. We post 5 days a week. All of our information is shareable, so you can reshare it, repost it. But one of the really exciting things that we're thrilled to be sharing with the industry is that we have a lived experience video coming out. And
Hmm.
we have 4 construction tradespeople that have shared their experiences with mental health and mental health and substance use. And they, in their own words, told their story. And there's a video that goes along with that with some resources to support it. So we will be sort of premiering that to the construction ecosystem on May 7th. And we'd love for you to join us on that webinar. So, anyone that's listening now, you can go to our website or you can go to our socials and sign up for that.
Wow, that's incredible. And yes, we'll be sure to pass that along and share it as well. That sounds incredibly powerful, and look forward to that. Well, thank you so much, Sonya. We've been talking to Sonya Bohmann, Executive Director of the Construction Industry Alliance for Suicide Prevention. Thank you so much for your time today and coming on to share this really important message with our audience.
Thanks for having me.
Thanks for listening to Spill the Ink, a podcast by Reputation Inc. We'll see you again next time, and be sure to click subscribe to get future episodes.